The incidence of celiac disease is on the rise globally, and there are multiple possible explanations for that. But despite its rising incidence, celiac disease remains underdiagnosed, which is a direct result of its multiple forms of presentation. In this video, we'll examine one such form of presentation, that of major depression. A 47-year-old woman with a history of irritable bowel syndrome and anemia was admitted to the psychiatric ward of a hospital for the third time. These frequent admissions were major domestic upheavals for this woman because she was a single mother and took care of her child. On the first two occasions, she was admitted because of suicide attempts. And this time, she was admitted because of a major bout of depression. During her stay at the hospital on the first two occasions, she was treated with psychotropic medications, but did not respond. She was, however, discharged with a diagnosis of personality disorder and factitious disorder, a condition in which patients make up diagnoses, psychiatric diagnoses, and medical diagnoses. While in the hospital, she became agitated and detached from her surroundings, and the doctors once again treated her with psychotropic medications and electroconvulsive therapy, neither of which helped her. They were frustrated by her lack of response to the treatment they were offering, and on this occasion, they decided to do an extensive workup to determine the underlying cause of her symptoms. A blood test was performed which showed anemia, low serum protein, and low serum calcium. They did a CAT scan and MRI of the brain, which showed nonspecific changes in the left frontal area of the brain. While she was in the hospital, she lost 10% of her body weight and developed severe diarrhea. They then ran a test on her stool, which showed traces of blood but was otherwise normal. They then did a CAT scan of the abdomen, which showed nonspecific changes in the bowel, and this prompted them to perform other tests looking for further gastrointestinal conditions. Anti-gliadin antibodies and anti-tissue transglutaminase antibodies were elevated, prompting the doctors to do an upper endoscopy and biopsy of the small bowel, which confirmed the diagnosis of celiac disease. She was then started on a gluten-free diet, and 2 months later, her gastrointestinal symptoms had disappeared, her psychiatric symptoms had disappeared, and all of her blood work had normalized. 4 years later, this woman remained asymptomatic and was able at that time to maintain a full-time job and take care of her child. Now, celiac disease is an autoimmune disease that was originally thought to be confined to the gut. We now know that celiac disease is a multi-organ system disease. It develops when patients develop a sensitivity to gluten that leads to the destruction of the finger-like projections in the bowel known as the villi, and this leads to malabsorption. The damage to the bowel wall that leads to malabsorption causes the symptoms that we see in celiac disease: abdominal pain and bloating and diarrhea. But beyond the gastrointestinal symptoms experienced by patients with celiac disease, they can also have extra-intestinal symptoms affecting other organ systems in the body. The skin, for example, they can have dermatitis herpetiformis, or in the bones, they can experience osteoporosis, thinning of the bones. In the liver, they can suffer from transaminitis, which is an elevation of the liver function enzymes. Their spleen, they may have hyperfunctioning of the spleen. They may have disease of the peripheral nervous system leading to peripheral neuropathy and ataxia. Or they may have psychiatric conditions which encompass a full range of different psychiatric conditions. But just what causes these psychiatric conditions in celiac disease remains a mystery. And researchers have proposed several theories to explain the link between psychiatric conditions and celiac disease. One such theory is the direct immune system effect, in that the stimulated immune system may produce antibodies that directly damage the nervous tissue in the brain, leading to psychiatric symptoms and psychiatric conditions. A second theory proposes that the damage of the intestinal wall leads to a breakdown in the barrier function of the intestine, and this permits the absorption of toxins and other metabolites that can travel to the brain and damage the brain. A third theory is a theory of a deficiency of certain nutrients due to the malabsorption that exists in celiac disease. And a deficiency may arise of vitamin B12, vitamin D, calcium, iron, and folic acid. And these can directly or indirectly affect the functioning of the brain. Finally, one theory proposes that the malabsorption existing in this condition leads to a low level of L-tryptophan in the blood. L-tryptophan is a precursor, an amino acid that is necessary for the production of serotonin. And as we know, serotonin is central to the regulation of our mood. Although we may not know what causes psychiatric disease in celiac disease, this case shows us that in select patients with depression and celiac disease, a diet free of gluten, a gluten-free diet, may affect a cure of their depression. Celiac disease is not just a disease of the bowel. It is a multi-organ systemic disease. Thank you for watching. Share this video with your friends and family, and you can support the channel by subscribing. Until the next video, stay healthy and stay safe.